periodontal treatments, which are big in a lot of the terriers, a lot of dogs in general, but especially the terriers, restoratives, fracture repair, tumors, palatal repairs, et cetera, et cetera. Um, in addition to dental radiographs, we also do cone beam CT imaging on most of our patients, which has kind of been a game changer for us. Um, so here, you can see some of these 3D reconstructions of a dog with a fractured jaw, and then you can see kind of a 2D version of that. And then on the bottom right is, some of the wiring we did to repair that. So I'm going to go into just basic anatomy. Now, a lot of you guys are really into the breed. Many of you are either breeding, I assume are either breeding or showing. So some of this may be basics, but since we're talking about the mouth, we want to, start from the beginning. So dogs, adult dogs should have 42 teeth. Puppies, anyone, well, sorry, it's not a Q&A thing. And puppies have 28. And puppies do not have any molars. So they just have premolars and then the canines and incisors. So when people ask about, oh, my puppy broke a molar, assuming they're still talking about the puppy teeth, they probably mean one of the premolars. Or a lot of times your veterinarian may say a puppy molar, but they mean a premolar. So when we look at the teeth, the incisors are those little guys up in front, kind of what I like to call the corn on the cob eating teeth. The canines are our big fang teeth, and then the premolars are the ones right behind the canines. And so the biggest tooth towards the back is not a molar. I'd say most people call it a molar, but it's technically a premolar. And that's the one that fractures the most commonly when we're chewing things that we shouldn't. But then the molars are behind that. And on the bottom jaw, the biggest tooth on the bottom jaw for chewing is a molar. So there's a lot of confusion sometimes. All right. So the dental anatomy for a dog or cat is similar but slightly different than that of a person. For one thing, on the crown of the tooth, well, first of all, the shape of the crowns of the teeth are very different. In dogs, they're only the teeth way in the back are made for chewing. The rest are for grinding, biting, ripping, pulling, shredding. And because of that, we see fewer cavities in dogs. That and the fact that our dogs aren't usually on high sugar, high carb diets. So we see, fewer cavities, but we see a lot more periodontal issues in part because of lack of home care. But, if you look at this diagram, the enamel, which is this white line, can everyone see my cursor?
Yes.
Okay. Um, so the enamel, this white line, is the hardest substance in the body. There's no nerve endings, there's no blood supply. And so once it's damaged or gone, it can't really repair itself. Now, the dentin, which is the layer underneath the enamel, comprises the bulk of the tooth. That's this kind of pinkish area. Now, dentin does have nerve endings, and it's right next to the blood supply, which is the pulp. And so when that senses danger or trauma, that has the potential to repair itself to a certain degree. So that's important. The other thing is that the dentin uh, continues to grow throughout the life of the tooth. Now it grows internally, and so what happens is the dentin right near the pulp lays more dentin, and so the pulp gets narrower and narrower as the tooth continues to mature and develop. So as long as the tooth is alive, there's always going to be more dentin produced. Now the rate of production decreases with age, but we always tend to see that. And then the big thing I mentioned for those who were on a little earlier that I had my first root canal in my own mouth a few weeks ago, and I was talking with the endodontist, and we were just commenting how the apical anatomy, or so basically the tip of the root, in people, it's just one or two typically holes where the blood and nerve supply is going in. With dogs and cats, it's more like what we call an apical delta, so almost like a river delta, where it's lots of little branches coming in and out. So there is some subtle differences that way. Um, when we're looking at especially show dogs, conformation dogs, breeding dogs, but even pet dogs, when we're trying to assess their comfort and function, we have to look at how the bite aligns. And so the first thing is when we're looking at the dog, you know, is everything symmetric? Our ears, are they set evenly with each other? The eyes, is the nose straight? Are there any lumps or bumps? Anything like that. So we're looking at that. Then we're looking at the central incisors. So there should be six incisors on top, six on the bottom. So right in the middle, does that gap between the two teeth, does that line up appropriately? Are the jaws of appropriate length? Do the premolars interdigitate appropriately, or are there any specific teeth out of position? So, for example, on a normal occlusion, normal bite, we have one, two, three incisors, one, two, three incisors, and the middle right here. And this lines up pretty much perfectly with the middle right here. So we have good left to right symmetry, at least up in front. So our jaw alignment is most likely good. When we look at the bite from the side, we see a normal scissors bite where the lower canine fits nicely between the third incisor and the canine. And then we have almost this picket fence zigzaggy pattern amongst the premolars. So that's also ideal. Now, I looked up the Scottish Terrier breed standard, and they said that a scissors bite or level bite is acceptable, but a scissors bite is preferred. And so this is kind of what we're looking for. Now, when we have what we call a class 2 malocclusion or an overbite, the lower jaw is too short, and I've seen this in some Scotties. And basically, if we look at the picture on the right, the incisors on the bottom are kind of poking behind, further behind the upper incisors than they should. And sometimes it's not a big hairy deal. It is what it is. Doesn't create any functional or comfort problems, but sometimes it does. Uh, and the most common issue that can cause is the lower canines kind of hitting the roof of the mouth instead of falling just to the side. It'll hit the roof of the mouth, and then that can create pain and trauma. But also, on this picture, we're missing the first premolar, but this tooth should be on on this side of the first premolar, which should be here. And then the opposite is our what we call a class 3 malocclusion or an underbite, where basically we look like a bulldog. So our lower incisors are in an inverse relationship with our upper incisors. And then again, on the side, our premolars are kind of out of alignment. So a lot of times when people are looking at the bite, they're mainly looking at just these front teeth, but sometimes these can be normal, but when you look at the premolars, things are abnormal. And so that can often determine that, yeah, we do have a discrepancy in our jaw length, even though cosmetically it looks similar to being normal. And then we can have what's called a wry bite, and this is a situation where there's a discrepancy to the right or left between the upper jaw and lower jaw. So on this patient here, you can see the central incisors here don't quite line up with the central incisors on the bottom. So there's a little bit of an issue there. Now, sometimes that can be developmental or genetic. Sometimes it can develop due to trauma, jaw fracture, any number of things. So if your dog has a normal bite and all of a sudden it's skewed to one side, that tells us something might be amiss. And then when we have what we call a class 1 malocclusion, it's basically the jaw length is okay, but we just have a one or multiple teeth out of alignment. So this picture on the left is what we call a posterior or caudal crossbite. We see this a lot in collies. So basically the fourth premolar on top, it should be on the outside of the first molar on the bottom, but it just goes backwards. Sometimes we'll see it, what we call an anterior crossbite, where the jaw length is normal, but one or multiple incisors on top, upper incisors, are behind the lower incisors. And in this picture on the right, we have a canine tooth that has erupted into the wrong position.
Mm.
So, when we talk about puppy teeth, because I get a lot of questions about puppy teeth, and even veterinarians calling saying, "Hey, I have this puppy where it broke its tooth. Do we need to do anything about it?" So, puppy teeth, they tend to erupt, give or take. Some breeds quicker, some breeds slower, but usually by about 2 weeks of age, we're starting to see those coming out. The puppy teeth are lost typically around they start losing them around 3.5 to 4 months of age, and they should be completely gone usually by about, 5 to 6 months of age. Again, depending on the breed. Some like Yorkies or Maltese or these little, teacup dogs, some of those will be delayed in both eruption and exfoliation. So that can sometimes create some issues where, okay, we're 8 months of age and we're still waiting for all of our teeth to erupt. I alluded to earlier, puppy teeth, if they're fractured, they should be treated. Um, if, especially if the pulp is exposed, because that's a highway for bacteria to get into the mouth, or excuse me, into the tooth, and then go out the end of the root and create infection or problems. Now, sometimes the infection or problem does not manifest into anything that we notice as being a problem. Sometimes you can see like a little pimple or boil looking spot on the gum line. And sometimes you don't notice anything till that adult tooth erupts and you see problems with the enamel at that adult tooth because the infection inhibited what's called amelogenesis, or basically formation of enamel. And so, yeah, I mean, unless the tooth is loose and ready to fall out, those puppy teeth should be, if they're broken or infected, they should be taken out sooner rather than later. The other thing with puppy teeth is if they don't fall out at an appropriate time, that can lead to some of those occlusion problems, some of those problems where the adult tooth doesn't erupt in the right location. Most common scenario for that is with the canine teeth, because, for example, with the upper canines, the puppy tooth, or excuse me, the adult tooth erupts in front of the puppy tooth. But if that puppy tooth is still there, that's going to cause the adult tooth to erupt even, too far forward. And then that can interfere with the lower canine tooth going into the correct position. Alternately, if we have the lower puppy tooth that's still there when the adult one erupts, the adult one erupts what we call lingually, or towards the tongue side. And so sometimes that puppy tooth can act like a shim and make that tooth, the adult tooth, erupt and start poking the roof of the mouth. And so that can be an issue as well. So I always tell veterinarians that anytime we have um, two teeth trying to occupy the same spot, problems can happen. It could be the teeth erupt in the wrong spot. It could be that we are at more risk for periodontal disease. So if you have an adult tooth and a puppy tooth vying for the same spot, one of them's got to go. So here are two examples. On the left, we see a broken
Mm.
puppy tooth, the canine tooth, and you can see that dark spot, and you can see how this tooth is discolored. And then we see this little draining spot right here. Now, the puppy tooth itself, the root of it goes way up over here. And so you can see this kind of faint line here, and that's called the mucogingival line. So oftentimes when we have an infected tooth, if it's going to abscess or create a draining tract, a lot of times it will be along this line. And so because this root goes up to about here, it's going to drain there.
Mm.
So if you see something like that, then it's worth investigation. Then here on this picture, we see the adult tooth trying to erupt, and the puppy tooth is still there. So we talked about how they're two teeth vying for the same location. So when that happens, again, we got to get this guy out of here so this tooth can erupt in this normal position over here. Because as you can see, as this one's going more forward, there's barely room for this puppy tooth, and you can kind of see the adult tooth here that also is too far lingual, too far hitting the palate because of this. There we go. Because of this tooth and because of this tooth being too far forward. So there's no room for this tooth to go.
Wow.
So I don't know if you guys have come across this craniomandibular osteopathy. Um, it's it's most common in Westies, but when you look at the list of breeds that can be affected by this, Scotties are right up there. And it's something that is genetic. And I was debating whether to put this in the presentation or not because it's not a super common thing. But I figured, it's something that is kind of known well enough that we should at least mention it. And so what happens is as the puppy is growing, and again, usually around 3 to 8 months of age, we'll start to see that. All of a sudden, the bone gets real proliferative. It gets really thickened and firm, and it can be sometimes a little painful. But what becomes a problem is that if it starts to grow further back and affect the TMJ or the hinge joint of the jaw, then it can really affect eating and appetite. So here are some CT images where you can see just really nasty, nasty overgrowth of the bone. And this can be devastating for some of these dogs. And here we can see it, where those arrows are back by the base of the skull, and that again can interfere with opening the mouth, picking up food, etc. Now, typically, this is believed to be autosomal recessive trait. So both parents have to be carriers for this to develop. So if you see this develop in one of your lines, then you need to do some investigating and see and maybe get those dogs out of the breeding program. Usually the growth stops by about a year of age, and a lot of it is just symptomatic supportive care. And sometimes we need surgery, not to necessarily get it back down to normal anatomy, but to kind of free up space so we can open and close our jaw. In severe cases, though, euthanasia is probably going to be the most humane thing for these dogs. But many dogs can outgrow this and do okay.
Steve, can I just interrupt for just 1 second? I
You
just want
bet.
to bring to everyone's attention that this CMO, that's one of the genetic screening tests that is available that responsible ethical breeders can do. And one question related to that. So when the surgery is done, do you go in there and shave down some of that bone? Or what do you
Yeah,
do?
unfortunately, I've never had to do that yet, so
Yeah,
I can't say in the 30 cases I've had I've done this, um, but yeah, usually if it's obstructing the TMJ, then depending on how or the opening and closing of the mouth, depending on where it is, it may be something where you shave it down. It may be something where you remove parts of the jaw. Again, depending on how severe or debilitating it is.
great. Thank you.
Yeah. Hopefully, I never have to intervene on one of those.
Um,
So. All right. So, probably the biggest dental issue we see in not only Scotties, but every cat and dog, is periodontal disease. So, periodontal disease is a chronic, progressive, inflammatory, and infectious disease process. It is a disease. And the vast majority, probably 70 to 80% of dogs by the time they're 2 or 3 years of age will have it to some degree or another. And there are four stages of periodontal disease. The first one being gingivitis. And that's basically just inflammation of the gum tissue. So you and I were brushing or flossing our own teeth and we get a little bleeding. What's that mean? It means we need to step up our game. We do a better job with brushing and flossing, and we find, lo and behold, the bleeding stops and the gums settle down. So gingivitis, again, the first stage of periodontal disease, is reversible. Now, when we get to stages 2, 3, and 4, then that's not so reversible without intervention. So periodontal disease, like if you look at some of these definitions, kind of an older one, inflammation of the gingiva, the gum tissue, it's an oldie but a goodie. I mean, it basically summarizes what it is. As you know, as medical knowledge advances, of course, everyone wants to come up with a more scientific sounding definition. And so like you look at in contemporary periodontics in 1990, they had to come up with something that sounded more impressive. But really, it's just inflammation of the gum tissue. Now, periodontitis is again, that's more stages 2, 3, and 4. And so basically what happens is we have gingivitis, and then that progresses to getting attachment loss around the tooth. So we start to lose attachment of the gum tissue. So we end up getting deeper periodontal pockets. So like for example, when you go to your dentist and they poke around your gums, one of the things they're checking for is gingivitis. Another thing they're checking for is how deep that probe goes down. Now in dogs, the classic answer is you don't want it going down any more than 3 millimeters. Well, I have some Great Danes where they may have 5 millimeter pockets and they're doing okay. I may have some Chihuahuas where they have 2 millimeter pockets and they have a lot of problems. So it's not a hard and fast rule because of bless you, because of our patients, but it's something where we have to take it all into relation with the patient. So basically what happens is we get destruction of the attachment around the gum tissue. We get destruction of the bone and the ligament that's holding the tooth into the bone, and the cementum, which is the outer layer of the tooth. So all that is affected, excuse me. So then eventually you end up getting something like this where you have a lot of loss of the gum tissue and the subsequent bone. You have what's called furcation exposure. So basically, the area between the roots has lost all support, and the infection is just going deeper and deeper and deeper down the root. Now, as I mentioned, it's very common in even younger dogs. I'd say little dogs and terriers and greyhounds are at higher risk than, say, a lab at a younger age. But again, exceptions exist. If in what we tend to see, you get the old dog breath. You see inflammation. You might see blood on chew toys, sometimes dropping food, things like that. Now, I've had patients where a number of patients where they come in and we take care of their periodontal disease. And when they're in for the 2-week recheck, the client is commenting that, oh, Fluffy is acting years younger. And what it was is they assumed it was just aging, but it was actually chronic infection and pain and disease that was slowing the animal down. Now, I always tell people I can't guarantee, that you're going to have that kind of response in every case, but it is kind of a good feeling when you know that all of a sudden they're acting years younger because of treatment. So, there's always the concern of periodontal disease creating effects, infection in the mouth, creating problems elsewhere in the body. So the kidneys, the heart, the lungs, joints, etc. And that's real. I think to some degree it's a little too oversimplified in that, yes, sometimes you will get bacteria from the mouth seeding other areas of the body and other organs. But kind of the bigger issue is just the chronic inflammation. So in people, they do a lot of research with C-reactive protein levels. And basically what these are is it's an inflammatory marker uh, or mediator that they test for to see what kind of levels of inflammation are in the body. And the higher those levels, the higher the risk of like arteriosclerosis and other issues in people. And they found that with periodontal treatments for these people, that they can get those levels to lower. And so I think I think that's probably in my opinion, a bigger concern than direct seeding of bacteria, although that can happen. I'm more concerned about the chronic effects of inflammation on the body. And they've looked at that to a lesser degree in dogs, but just measuring C-reactive protein levels in dogs before and after periodontal treatments, and they found a reduction in that as well. So I think, we can extrapolate some of that information to say if we can keep the periodontal health lower, that may help in the long term for the overall health of our dogs. And if it doesn't help with the longevity, it'll at least help with quality of life. So again, just kind of the four stages of periodontal disease. On the left here, we have just gingivitis, and I say just gingivitis in air quotes because gingivitis then leads to early periodontitis, where we start to get some pocket depth, start to get a little bit of bone loss. Then as we get to more advanced stage 3, again, we have more bone loss. It's going deeper down the root. And then stage 4, there's a lot of bone loss. And then we get like the little piano key teeth that are just kind of wiggling like we see on these little poodles and chihuahuas and whatnot. So the best way to diagnose periodontal disease is with x-rays and probing. And with, you can get a somewhat of a picture with one without the other, but you can't get a complete picture without both. So again, stage 0 basically meaning no disease. We have nice healthy gum tissue, a little bit of tartar there. And the bone height is really good. When we get to stage 1, again, we still have really good bone height because again, stage 1 is just gingivitis. So it hasn't affected the bone yet. But we're seeing a little bit of tartar. We're seeing, a little bit of some swelling of the gums in some of these areas. As we get to stage 2, in this example, we're getting a little bit more swelling of the gums. We're getting a little bit of deeper pockets. We're starting to see a little bit of some bone loss here. And so, we're starting to see some of these subtle changes. This may not require surgical intervention yet, but we need to really step up our game with brushing, home care, regular cleanings, etc. When we get to stage 3, we get more and more bone loss. And so here we can see, unfortunately, the A is covering the defect, but we're getting bone loss down here. And so with stage 3, the bone loss is usually between 25 and 50% of the bone around the root. But if you're losing half of the bone around the root, you're starting to get in trouble. And stage 4 is kind of a train wreck. So if we look at these x-rays, for example, we can see that the bone height is down here at the yellow, but it should be up at the red. And so we've lost a lot of bone. We've lost more than 50% of the bone. And I mean, this is an extreme example with the tartar, but again, you're getting loose teeth, you're getting chronic infection, all that. So what causes periodontal disease? So periodontal disease is caused by plaque initially. So plaque starts forming within seconds or minutes of a cleaning, be it a person or a dog or a cat. And think of it with yourself. You brush your teeth before you go to bed. Then when you wake up, you have that little slime layer on your teeth. That's the beginning of the plaque, or what's called the pellicle, which is that first film layer on the tooth. And so when that happens, it's basically a bunch of glycoproteins and enzymes and things like that help protect the tooth and the gum tissue from desiccation. But it also allows bacteria to adhere. So then bacteria can kind of hang out in that slime layer, and they're somewhat protected from the environment, and they start to reproduce. And as they reproduce, they can start to release toxins and enzymes, which can lead to breakdown of the gum tissue, breakdown of the bone, etc. Now, what also happens is, assuming we have an appropriately acting immune system, the immune system decides, hey, I sense something's going on. So the immune system starts to send, its cells and, enzymes to help fight this battle. And so, as in any war, it's the infrastructure that gets lost. So, in this case, the infrastructure being the gum tissue, the bone, the ligaments, all that. So, as the body is trying to fend off this bacteria and the bacteria is trying to survive, things are starting to get wiped out. So, you have this protective slime layer, and over several days, as it sits there, it'll start to mineralize and form tartar or calculus. And then that's even harder to get off. So people ask me a lot about water additives, like that you can put in the food or these rinses. And I, heck, I use Listerine, so I'm basically using a rinse as well. And the analogy, and I think there is a place for them, and they do serve a purpose, but they're not the be all and end all. For example, if you take a plastic bucket and fill it with water and let it sit there for a few days, and then you dump the water bucket, you'll have that slime layer that starts to form. To a certain degree, you can rinse it away, but it cleans off best if you brush it, if you wipe it down. And same thing with the teeth. All the water additives and chew toys and things like that in the world aren't going to be as effective as brushing. And there's a reason brushes have bristles, and that's so you can get below the gum line, because the plaque on the crown of the tooth is just there. It's not really doing a whole lot compared to what's below the gum line, at and below the gum line. So if we can attack, in particular, what's at and below the gum line, that's going to make a huge difference in cutting down, our periodontal issues. So, unfortunately, with in my clientele and patients, by the time we see a lot of these patients with periodontal disease, it's more of a salvage procedure, especially with the advanced ones. The 12-year-old Yorkie that comes in that's missing half its teeth and the other teeth are looking like this. There's not going to be a lot we're going to do to try and save these teeth. In cases where we have to remove most or all of these teeth, the dogs are usually happier because, as you can imagine, something that looks like that is not going to be comfortable. But if we can catch things early enough, and these teeth should probably be extracted too, but if we can catch things early enough, there are some other things that we can do to try and save these teeth. And that could be, different types of gum surgery, bone grafts, trying to rebuild tissues, things like that. So if we can catch these in stages, 1, 2, and 3, there's a lot we can do to try and save these teeth. Now, there are some non-surgical things we can do too, in particular in the stages 2 or 3, where we can do more deep cleaning, where we can where we can place certain medications within the pockets of the teeth. And then also, sometimes medications or supplements and different home products, but none of this is going to be a replacement for brushing. And if we can't brush our teeth at home, then it's trying to save these teeth with doing advanced gum surgery and things like that is going to be less successful. Let's just put it that way, because whatever we do to treat this, as soon as we get home, it's going to revert back to where it was if we're not brushing and maintaining. And so we need to, when we select some of these other other therapies, we need to make sure we have a compliant patient and a willing owner. A lot of times the owner is willing, but the dog isn't. Or sometimes the dog is willing, but the owner just doesn't see the priority in it. So, it has to be a team effort between the veterinarian, the dog, and the family to try and keep these teeth happy and healthy. A lot of people ask about antibiotics. There's a time and place for them, but as monotherapy, antibiotics are a band-aid on a bleeding aortic aneurysm. It's just not going to do anything. So there are some things that your vet may recommend, either after cleaning or in general. This Oravet gel, it's kind of like a wax that you apply to the teeth along the tooth gum margin. Because again, remember, our big concern is around the gum line. So it's applied after cleaning to the enamel to help reduce plaque accumulation. And then the owner applies it once a week at home. And if you're diligent about it and along with brushing, it can be very effective. Sanos is another product that's out there that lasts, they claim, up to 6 months. Um, Not every veterinary dentist is sold on this product in that the company makes a lot of claims and it may work as they claim, but they're they're not forthcoming with a lot of the literature on it and a lot of the research. So some of us are a little hesitant to do this. Some of us use it and like it, and it's just kind of personal preference. Then there's some other things that your veterinarian may recommend after a cleaning, such as like a chlorhexidine rinse, which helps to not only decrease gingivitis, but helps to kind of keep the mouth a little cleaner, keep the bacterial burden down, etc. MaxiGuard gel is something also that we'll sometimes use in addition to keeping the mouth cleaner. It helps improve healing for some of these major periodontal surgeries. 1TDC, this is something you can pick up on Amazon. You can get from your vet. Not many vets have not heard of this product, but the veterinary dentist James Anthony, who did a lot of the research on this, he's kind of a friend of mine, so that disclaimer. But they've looked at this in rabbits and then in cats and dogs, and this can help reduce gingivitis. It can help improve the bone and gum health. And basically, you can see on this picture here, this is enlarged, but it's like two hearts butt to butt. And when you twist one end off and then you squeeze the contents of the gel cap, you squeeze the contents onto the upper gums. Then the dog licks it and kind of spreads it around that way. And that it's again a fatty acid supplement, and that helps reduce the inflammation. They claim it also helps with joint pain, arthritis, things like that, but I don't really care about that. So, my biggest go-to for when people ask about recommendations is this website, the VOHC, the Veterinary Oral Health Council. And it's basically a bunch of veterinary dentists and researchers who apparently have nothing else to do. So they review different products. So a company, let's say, we'll just say Greenies, has this product and they say, hey, we want to have this evaluated to get the seal of approval. So then they pay the VOHC some money. VOHC, independently reviews the research and then says, okay, yep, this has our seal of approval, or no, it doesn't. If it doesn't meet criteria, no one knows about it. So they don't advertise this product failed. If it does meet approval, then it gets the seal of approval and it's listed on their website. So I always tell people, with VOHC products or with products in general, this includes dental diets, dental treats, water additives, toothpastes, whatever the case may be. I always tell people, go to that website first, see what's approved, or when you're at the pet shop, look for that seal of approval. And that's a good starting point. Now, there may be other products out there that have not jumped through those hoops or gone over those hurdles to get VOHC approval that may work very well, but I just can't say that they do or don't. So when you're at the pet store, it's kind of a buyer beware with some of this stuff because, some of that stuff is snake oil and some of it is legit. And the VOHC helps discern which stuff is legit but but not everyone has gone through that. So does that make sense? Okay, I see some nodding. Okay. Um, so some of the VOHC home products, greenies. My dogs get upset if they don't get their nightly greenie. The CET chews are good as well. Pet Smile toothpaste. I'll have a lot of clients ask me about, toothpaste recommendations, and Pet Smile I recommend. The CET toothpaste is also commonly recommended. Um, but I'm not a toothpaste snob. And what I mean by that is if you find the most crappy generic Walmart pet toothpaste, as long as it's safe, and your pet likes that and doesn't like the Pet Smile or whatever the, best toothpaste in the world is, the crappy one is going to work better than the one your pet doesn't like. So I always tell people find a flavor or a brand they like and go with it. Because I mean, yes, the enzymes and the ingredients and some of these other ones may make it better, but the act of mechanically brushing the tooth gives you most of the benefit. So before we leave periodontal disease, I just want to talk quickly about CUPS or CCUS. It's a kind of the angry cousin of periodontal disease. So if we look at, these pictures, we have a lot of gingivitis, we have some receding gum and bone, but then we have these ulcers, these sores, basically where when the lip is down, it's in contact with heavy plaque burdened areas, and that can make it very painful to even eat, to brush, to do any of that. So when we get into this realm, it's kind of a whole different ball game as far as more so than periodontal disease. In some dogs, it requires removing all of the teeth. In some dogs, it requires, cleanings every few months, along with brushing twice a day and home care products and all these things. So I'm not going to go into too much detail about this. And sometimes that is one where medications are appropriate. Okay, so now we're going to talk about fractured teeth. Scotties are no stranger to that because they like to chew. So enamel is the hardest substance in the body. It's harder than bone. It's harder than um, lots of basically anything. But like we talked about, once it's gone or damaged, it's gone or damaged. Again, it surrounds the tooth, but not the root, and it protects the dentin. And it is super thin. So in cats and dogs, enamel is very thin, which is a detriment because in people, it's very thick, which is great for us because it's harder for cavities, for example, to go through enamel than it is through the dentin. And our teeth, because of our longevity, should last a lot longer. So we want all that enamel. Unfortunately, our pets don't live as long, but they're more aggressive with their teeth, but their enamel is much, much thinner. So that kind of sucks. So on the left, we have kind of an illustration of a human tooth, and look at that thick enamel. And then again, the piddly amount of enamel on a dog's tooth. So dentin, which we talked about earlier, which is underneath the enamel, is softer than enamel, but it's a little bit harder than bone. And again, comprises the majority of the structure, but can change thickness throughout life and has the ability to repair. So, but with dentin, there's little microscopic tubules, and that's how the dentin senses if something's amiss. And so as you get closer to the pulp, there's nerve endings and blood supply. And so with these little holes that we see here, bacteria can leach through here. And that can also create sensitivity. So when you're outside in winter and you kind of breathe in, you get a little zinger on your teeth, that's where the enamel is thin or missing and the dentin may be exposed. And again, there's tons of little tubules in a very small area on the tooth. And so, any sort of fracture, even if it doesn't expose the pulp, can create some sensitivity. So here's a not to scale diagram showing some receding gum. Here we have some exposed dentin and again, those tubules. So that again is going to create potentially some sensitivity. And here we have odontoblasts, which are the cells that create more dentin. And we can see nerve endings, all that. So again, even if there's no direct exposure of the pulp, it can be sensitive for these guys. So there's different classifications of fractured teeth. So the simplest is enamel infraction, and basically just a little cracking of the enamel, usually from some sort of flexural stress or strain on the tooth. Then we can develop just an enamel fracture where the enamel is broken off, but not the dentin, and we may still be okay as far as sensitivity. So basically like a minor chip tooth. Then we get to what's called an uncomplicated crown fracture. So basically, we've lost some of the enamel and we fractured some of the dentin. And again, that can be sensitive. And here we have, yeah, we have another version just on a canine. Here we have a fracture that does not involve the pulp, but is going underneath the gum line. And so that's called a crown root fracture. And then here we have a fracture exposing the pulp. And in this case, it's going below the gum line as well. And then the good old root fracture. You don't see any fracture, but lo and behold, either the tooth sometimes is wiggly, sometimes it's not. And then on imaging, you may see, yeah, we have a fractured root. So here's a tooth I saw where there was a fracture, but no direct exposure of the pulp. So what we did is we smoothed out those edges and put a sealant on it so it's less sensitive. Here we have a fracture, again, not exposing the pulp, but going a little bit underneath the gum line. Here we did a little bit of a composite filling and sealant over that. Then this poor guy, there's pulp exposure, so the blood nerve supply is exposed. And we did what's called vital pulp therapy. So we basically, to keep the tooth alive and happy, because this was a young dog, we removed a portion of the pulp, put some medicine over that, and then a couple layers of a filling over that. And then it looks like that. And here's a fractured tooth also with pulp exposure that we did a root canal on. And then sometimes we take them out. Now, this tooth is worn, probably from a lot of aggressive chewing. You see these dark stains, that's what we call tertiary or reparative dentin. So basically the dentin, as it structures and reorganizes when it senses something's amiss, it will reorganize not in a nice organized pattern, and so it may take up more stain. So we tend to see a lot of broken teeth from real bones, antlers, hard nylon bones. I've learned to not say nylobones because I had a veterinary dentist friend who got threatened by the nylabone company for a lawsuit. So nylon bones, not brand specific. And so, yeah, we want to avoid those. Here we have, an end of a knuckle bone, and it even calls itself a jawbreaker. And when we chew stuff like this, that's what happens. Because again, these teeth in particular, like this fourth premolar and the first molar that it's covering, they're not made for chewing. They're made for shearing and biting and tearing. Just the anatomy of how they're built. So enamel can fracture up to 200 psi. Dentin up to 350. Now, per psi. Now, even though I said enamel is the hardest substance in the body, again, it's much thinner. So it may not take as much force to break it. The whole tooth can fracture up to 800 psi. Now, what is the bite force of a dog? Well, a human, we can't. I mean, I guess Mike Tyson bit off part of an Evander Holyfield's ear, but aside from that, I mean, we can't bite very hard. Cats, domestic cats. I mean, I'm not talking mountain lions and tigers, but domestic cats, it's not real high. Dogs, on the other hand, depending on the breed, especially some of these big breeds, can be really high. Now, the problem with these studies is these dogs aren't trying to necessarily bite as hard as they can. Now, sometimes what they'll do is they'll put bite force sensors in sleeves on some of these protection dogs that go and bite the sleeves and try and uh, figure it out that way. Or with tigers, they've put bite sensors in like a chunk of meat to see how they bite it. But it's not like we're telling the dog now bite as hard as you can. Because like with these protection dogs, yeah, they're trying to bite hard, but they're trying to hold on. They're not trying to break an arm. They're just trying to hold on. So with some of these big dogs in particular, I would not be surprised if their bite force is higher than that. So something's got to give. And if we go back to this, guess what? It could be the product, but it often is the tooth. So what do we recommend for chew toys? So Dr. Fraser Hale, he's a Canadian dentist, a veterinary dentist, and he says he likes to give everything the knee test. And basically, he says if you don't want to be smacked in the knee with it hard, then it's probably too hard for the teeth. Now, okay, that's one way to look at it, but I'm kind of wimpy and I don't want to be smacked in the knee with anything. So my rule of thumb is if you can bend it, flex it, imprint your fingernail, or it's made to crumble, it's probably going to be safer for the teeth than things that don't have those properties. Now, the flip side of that is you have to be careful that they don't start swallowing pieces that are too big because that can be more dangerous than a broken tooth. And then I also send people to the VOHC website for chew toy recommendations. What about tennis balls? If your dog is super ball motivated, no. If your dog just likes to go and play fetch a little bit here and there, sure, that's fine. The problem with tennis balls is that felt material over time is going to pick up dirt, sand, etc., and then it acts like sandpaper, and then it starts to wear the teeth down. I've seen some of these border collies and um, Aussies and stuff that are real ball motivated. Their teeth are worn down to the gum line because of these tennis balls. So yeah, if we can avoid some of that, that would be fantastic. So um, when we have a dental cleaning, now each practice is going to be a little bit different. Um, but some places will call it just a dental or dental cleaning. Some will call it an oral APT. Um, and many places will call it a COHAT for a comprehensive oral health assessment and treatment. Again, we're just trying to make it sound fancier than it is. Okay. Um, and there's, multiple steps involved with this. And we were talking earlier about oftentimes before this started, there's a lack of communication, especially with dental work, on what actually is found and needs to be done. And so for most veterinarians, the options are cleaning or extracting teeth. Um, and unfortunately, most of what I do is clean and extract teeth, but I get excited when I get to do other stuff. But it's more than just cleaning teeth. It starts with examining the mouth on the awake patient and consulting with the client, with you, the owner. Then, we need to do our preoperative labs, make sure that everything's okay for anesthesia, because to do a good job, they need to be under anesthesia. We'll usually give them some sort of sedative or kind of doggy downer, if you will, so that they're less stressed. They're easier to handle for placing IVs, things like that. And that also allows us to use lower doses of the anesthetic and thus making everything a little bit safer. So then we'll place an IV, so they'll be on fluids. We'll get them sleeping. We'll hook them up to all sorts of monitors and bells and whistles and that sort of thing. And then we're going to evaluate the mouth by imaging. So, so your vet should be doing dental x-rays. That is the standard of care now. We do dental x-rays and we do cone beam CT imaging. So we take it that step beyond, but dental x-rays, at least that. Then we're evaluating the mouth, not just the teeth, but also the soft tissues. There have been 4 or 5 patients in this past year where I found tonsillar cysts or tumors. And so if you're not looking, you're going to miss that stuff. So we're evaluating the tongue, the cheeks, the palates, the pharynx back of the throat, the tonsils, the teeth, all those things. And then we're going to clean up the teeth. So we're going to make them kissably fresh. And then once we have all those findings, then, the pet owner should be contacted to discuss what we're finding. And if there are treatments that are needed, then we discuss that, revise the estimate if necessary. And then as soon as we hang up the phone, then we're performing any of those treatments. Afterwards, we're waking up the patient. And just waking up the patient is fine, but then you have to be monitoring the patient because sometimes the most dangerous part is recovery. And so you need to make sure that someone's monitoring your pet, for the first couple hours or so, hour or two after anesthesia to make sure that they're recovering appropriately. Then at discharge, they should be going over, what you should be looking out for, what your instructions are, and then going over home care and scheduling a follow-up, be it to, double check the work that was done or, okay, when's our next cleaning supposed to be? So it shouldn't be just a drop off for a dental cleaning and then pick up and go about your way. There's a lot that goes into it. And yeah, like we talked about earlier, you have to be an advocate for your dog. So hopefully this works. Here's a video that Dr. Crescent made, oh gosh, maybe 9 years ago on toothbrushing. So we'll see if this works. And here we go.
Hi, I'm Dr. Dale Cresson of the Animal Dentistry and Oral Surgery Specialists. Did you know periodontal disease is the #1 disease of all problems in our small animals? The good news is there's something that you can do about it. If you can brush your pet's teeth on a daily basis, it'll make a gigantic difference. Now, we're going to demonstrate the proper techniques.
Because I am right-handed, I position Shinda on my left side. I lift up her lip and insert the brush. I start in the back and I come to the front with circular motions. I make sure that the bristles effectively go up into the gum line to remove any plaque bacteria that is hiding there. I then come to the front and I use an up and down motion on her incisors and canine. I then go to the other side and continue the process. When I'm completed with that, I gently open her mouth and with a firm hold over her nose, I insert the brush and brush the back side of the incisors and canine. So remember, starting at the back, use a circular motion. As you come to the front, use an up and down motion. And always remember that the bristles need to go up into the gum line to remove any plaque bacteria. There are a variety of toothbrushes that can be used. Try a few and find the one that is best for your hand. There are rotary brushes that do some of the work for you. Otherwise, there are brushes that have tilted brush heads and even ones that you can put on your finger. Slide this brush onto your finger, add the toothpaste, and you're good to go. Remember to choose a toothpaste specifically for your pet. Having an enzymatic ingredient does help prevent plaque and bacteria. When applying the toothpaste to the brush, apply a small amount and push it into the bristles. This prevents your pet from licking it off on the first lick.
So remember, periodontal disease is the #1 problem in our pets, and it's all up to you. If you decide that you're going to brush your pet's teeth, you'll make a huge difference in their life. You'll benefit, and so will they.
All right. So yeah, don't call that phone number because that location isn't around anymore. But All right. Any questions?
Can you give us a estimation of what you think a normal primary care vet would choose to charge for a dental cleaning? And the other piece to that question is, do you think that commonly primary vets do x-rays or not?
Um, what they charge is all over the map.
Sure.
I know there are some places that still charge $300-$400, and there are some that are closer to 1,800. And you have to look and see what that all includes. You know, does the price quoted include lab work? Does it include x-rays? Does it include IV? Does it include, go home meds? What's all involved with that? And also, if you're up in, you know, um, rural Wisconsin versus, Chicago, their prices are going to be different as well. Um, and then I apologize. What was the second question?
Um,
Oh, the x-rays.
oh,
Yeah.
x-rays.
Yeah.
Yeah.
It is considered the standard of care now. I know in some states, they mandate it as uh, required by state law or statute or whatever. In Wisconsin, we don't have that. I still know of some places that don't have it or make it optional. Um, and but those are getting fewer and further between.
So we have a question from Mary. Do you suggest that all dogs should see a dentist, or is their primary care okay? And how
Well,
often should they see a dentist or get a dental cleaning?
Well, of course, I'm going to be biased and say yes, they should. But if you're not having any issues and you're just needing regular cleanings, most general dentists can provide that care and do it well. Um, and there are some people who just are like, nope, I want to see someone board certified, and that's great.
Mhm.
Um, and we do regular cleanings, for example, but yeah, I mean, most general dentists can do the basics, but it's something where you'd want to ask, you know, who's doing the cleaning? Because some places it's a certified technician, some places it's the doctor, some places it's just an assistant or someone who is coming in after, working, coming in after school and they work in high school, so you never know. Um, then the other question to ask is, okay, if we do have a problem or something is found, what treatment options are available? Because if, for example, if you're looking for more advanced care and let's say your dog goes in and they find all these issues and they're like, well, we're going to have to either clean them or extract them. But if you want other care, then you may have to then wake the dog up and then come and see me or one of my colleagues, and have your dog under again and kind of go through that more cost, more anesthesia. So I don't want to discourage people from using their local vet. But again, depends on what you're looking for.
Right, right. We have a question from Linda in Texas. Can you discuss some of the concerns with cleaning teeth for a dog with chronic kidney disease, such as stage 2 or 3?
Yeah, great question. I would say if I had to venture a guess, maybe 10 to 20% of my caseload, uh, probably higher than that actually, is pets with kidney or heart disease. Um, in particular, anesthesia can have deleterious effects on the kidneys, especially if they're not being appropriately managed under anesthesia. So, for example, if our blood pressure is not being kept up, that can affect perfusion to the kidneys, which can then ramp up shutdown of the nephrons in the kidneys and make things worse. You may not see it that day or that week, but if our natural timeline and progression was going to be that things are going to crash and burn in 6 months, you might see it in 5 months, but you would never know. Now, that being said, if we're not taking care of the teeth, that can have deleterious effects on the kidneys as well and also ramp things up. So what you have, it's a rock and a hard place. And so what you have to do though is really make sure that your veterinarian knows what to do for these kidney patients and knows and has appropriate monitoring. Are they monitoring blood pressure and perfusion? And especially with these little cats and dogs, a lot of times your basic anesthetic monitor for blood pressure will not be accurate for the little patients. And so you may have to go to a Doppler blood pressure to monitor. Now, in my practice, one thing I haven't mentioned is that we have an anesthesiologist not on staff, but we work virtually and remotely with him. And so yeah, he's always having us, especially with these kidney patients, be extra cautious with that. So
Okay, I'm trying to go up this list of
I
questions
hope
here.
that answered her question.
I think it did. Linda, let me know if you are looking for more info. This one comes from Erica, who's in New Jersey. I have a dog adopted with CUPS or cups. She's had her cleanings every year and clindamycin periodically,
Mhm.
but doesn't help much or for long. She's 9 now. Her muzzle is very short and hard to hold with her fighting to get into her mouth.
Mhm.
Suggestions.
Well, I can't make specific suggestions or recommendations because I haven't examined the pet. But that said, I would most likely look at more than once a year cleanings. It might be something where we're having to do that every 3 or 4 months. And it may be something where if there are specific difficult spots to control, then it may be in everyone's best interest to extract those teeth just if we can't brush those well, just so that we can hopefully stop that cycle. So that might be something to consider.
Okay. Thank you. My fosters are just about 12. This is from Nan in Illinois. In their case with upcoming dentals, should the approach be when in doubt, take it out?
I don't answer questions from people in Illinois or Minnesota.
Because they're not Packer
No.
fans.
No. It depends. If they're if they're fosters, I mean, I guess it depends on what the foster group wants. Or you own them now, or
They would be placed in someone's foster care
right?
until they're
Yeah,
home permanently.
I
Yeah, I mean, I
don't,
guess I would.
the
That makes it
foster,
tricky because if
yeah,
it's someone who's able, who they get fostered out to, who's able and willing to do home care, then you don't
oh
want to
yeah,
take the teeth out. But at the same time, you don't know if they're going to be able to do that. And they may have the best intentions. But yeah, in like a shelter situation or a foster situation where you don't know where they're going to end up, then yeah, if something's borderline, I tend to be more aggressive than just because we don't want them suffering.
if I can say this, my question was more toward because of their age,
Oh,
because
okay.
I will do anything for them. I will do anything to take care of them and up to and very possibly failing as a foster parent.
Mhm.
So it may happen.
Yeah, so there's two schools of thought on that. Like just older pets in general, that I often have conversations with clients in that, they'll say, okay, well, Fido's a, 13-year-old dog, and we're seeing some teeth that, okay, let's say, X number of teeth have to go, and then there's these other teeth that are kind of borderline. Yeah, I don't think they're going to cause problems now. They may in the future. So do we think, okay, in the future, maybe longer than they're going to live? Or is it something where in the future, okay, they may not be as healthy as they are now to have it treated then? And so that's really a decision you have to look at each individual dog, at your situation, and decide, is it worth potentially having to go through this again or not? To be aggressive now or more conservative now?
I think you addressed this, but I'm going to pose this anyway. Does the
Mhm.
dog, this is from Patricia, I'm not sure where she's from, but does the dog need to have antibiotics given 2 to 3 days prior to the dental cleaning?
For
And if,
most dogs, no.
right, and if not, prior to the cleaning, can it trigger heart issues?
For a healthy dog, no. So anytime, like when you have your teeth cleaned, be it you or your dog, get almost an instantaneous bacteremia. So bacteria are circulating through the bloodstream. Usually the immune system takes care of that in seconds. Now, if you have an animal with heart disease, or you have a diabetic, or a few other things, I usually won't do. It's rare that I'll do some preemptive antibiotics unless there's active infection that we want to get the infection burden down. Um, but in some of those cases, I may give an injection of an antibiotic if they have some of these, other health issues. But for your average healthy run-of-the-mill dog, it's overkill.
Okay.
My staff gets frustrated because most of our antibiotics that we keep in stock expire, and then we have to throw it out and get new ones because I'm not a huge antibiotic user.
Okay. Couple of little questions here. Are there rotary toothbrushes specifically for dogs?
I believe there are.
Yeah.
Um, I've tried my electric toothbrush on my dogs, and they're not fans. Um, but what seems to be the most effective for many people is like a children's toothbrush,
Mm-hmm.
because it's a little gentler, not as in your face, so to speak. So, so that's a good intro. Those I think are good introductions to electric toothbrushes, the children's ones.
Okay. And is there a good alternative to a toothbrush and a dog with a smaller mouth that can help with daily cleaning? You showed that little finger brush thing.
Hmm.
That
Hmm.
was kind of cool. Are those
Yeah,
available on Amazon?
I don't know that.
Okay.
We've we used to carry a lot of those, and now they're becoming harder to get through the manufacturer and through our distributors.
Okay.
So there's a different one now that we use more commonly in cats because we'd use that in cats and small dogs. And it's just a little brush. It almost looks like just like a little round handle with some bristles at the end. Um, and yeah, I don't have a picture of it,
Okay.
but
Is,
but yeah, there are some smaller things out there.
is there an appropriate term that one would use if they were going to search for that on the internet, for instance?
Um, why don't I look that up and then I'll email you
Perfect.
later and you can send it to the group.
Perfect. Another
Remind me.
another question I will. Another question, CE2 CET choose. I worry
Mhm.
about choking hazard.
I don't give them to my dogs because it's the cream colored doodle that you saw.
Yep.
It's almost like the magician's act where I'm sitting here pulling the pulling the the rawhide chew out. Yeah, so my dogs are idiots and they don't know how to chew those appropriately.
Yeah, yeah. And I've had the same thing happen with those and or greenies. Dogs will chew them and then they'll disappear. They'll just swallow them. So
Oh, my dogs are great with greenies, so
yeah,
yeah,
it's the um old adage, supervision is necessary,
yes.
you know. Um, I think Scotty brought up she's got an aggressive dog chewer, which most Scotties
Mhm.
are. She hasn't found any soft chew toy that he doesn't break into large pieces. Any suggestions besides the knee test?
Kongs. Um, the there's also a company called Go Nuts.
Okay.
It's almost like a Kong material, but
Uh-huh.
I believe with them, then they have different levels, and there's a lot of companies coming out with stuff that lasts longer.
Okay.
But like for example, with the Go Nuts, it's almost like a Kong material. But if your dog chews or destroys it, then they'll give you a new one for free. You just pay shipping.
Okay.
Um, and I'm not recommending them, but I've had clients have some good success with that.
Okay. Another question from Erica. Erica does one of our major Scotty rescues in the country.
Mhm.
She has another adopted dog who came in with all black teeth and rotten, who needed to
Mhm.
have all of them removed right away. There was a spot where the jaw seemed to calcify with the chunk that needed to be shaved down. Now, 2 years later, she has mouth cancer, not melanoma. In
Mhm.
that area that's spread around her mouth, but it's been slow. And it's hard for you to make a judgment on this because you didn't do an exam. But do you think the cancer was caused by the years of neglect or unrelated? She's
Hard to
too
say.
old. She's too old for my vet to want to do anesthesia. She's otherwise healthy, but this will kill her. if there's nothing I can do. Supposedly no chemo exists. Any thoughts?
Do we know what kind of cancer?
Just that it's not melanoma, I guess. No, she said no.
Okay. I mean, depending on where it is, you can look at surgical removal of it, and what kind of cancer it is. It's one of those you don't want to necessarily put an older dog through that if the cancer is already spread to other places. But when it comes to age, my grandmother once told her physician, age is not a disease. And I've taken that to heart. And I mean, we anesthetized, I think we had a 19-year-old dog last year that we anesthetized. So, yeah, age is not a disease. It may be something where, she talks to a surgeon or an oncologist as opposed to just her vet to
Yeah.
see what options she may have.
Yeah. Would there be different kind of monitoring that you would recommend in an older dog because
Um,
of that age factor? Because I
yeah, I mean, well, with us, we monitor every patient the same, and that's with
Right.
everything. So yeah, we want to make sure that for every patient, you're monitoring heart rate, respiratory rate, end tidal CO2,
Mhm.
to see how well they're ventilating, their oxygen saturation, blood pressure, temperature, and EKG.
Okay.
If I had to pick just one or two, it'd be the um, blood pressure and end tidal CO2. Those two things will give you more information than any other two combinations.
Yeah. And in your experience, most primary care vets would not have the end-tidal CO2 monitoring.
Most do,
Oh, they
or
do.
many do.
Okay.
Yeah.
Okay, great. One new message here. Okay. I think that covers all the questions that we've got. I really want to thank you. This is like incredible. Oh, one other question I just saw from John. Are you familiar with Vetradent, tooth spray? They use the spray prior to brushing.
I've heard of it. I'm not familiar with using it myself. Um, but yeah, if you're using it prior to brushing, he can correct me if I'm wrong, but if I'm remembering correctly, it's supposed to help soften things. And but yeah, I have no problem with doing that.
Okay. And someone had a tooth that had a dog with a tooth that, let's see, where is that? The canine tooth turned pink.
Hmm.
What could have been the cause or a sign of another disease?
So a pink tooth is usually, there's a couple other potential causes, but the most common cause is what's called pulpitis.
Okay.
So basically, you had some sort of concussive trauma to the tooth, not enough to break the tooth, but enough to, it's not a correct term, but sprain the tooth. So think of like if you sprain your ankle, what's your ankle want to do? It wants to swell. And so if you bang the tooth hard enough, not hard enough to break, the pulp within the tooth wants to swell, but it's encased in tooth, so it can't. So then you get bleeding and basically bruising inside the tooth, and it creates that kind of pink stain, pink or purple stain. Eventually, a lot of times it'll become like a purple gray color. Um, and basically what happens is the pulp is decaying, it's dying off then. 90+% of the time you have pulpitis, it's irreversible and the pulp dies. So then the concern is you have dead necrotic pulp within the tooth. And so in a certain percentage of time, that can become a source of infection for either that tooth or the rest of the body. So the general recommendation in most circles is to either have the tooth extracted or perform root canal therapy.
Okay.
Now, if, for example, I have a 14-year-old lab that comes in and has a discolored tooth and it's been discolored for 10 years, and there's no evidence of it being a problem, I'm not going to jump to removing it or doing a root canal, and unless the client really wants to. I'm not going to push it hard, but in a young middle-aged dog, especially if it just happened, I'd want to treat it, be more proactive.
Okay. One last question, Steve, before I let you go. is there a site that people could go to check for veterinary dentists or certified veterinary dentists? That's hard for me to say.
Yeah.
Around the country, is there a general site that you would recommend?
Yeah, and I should have put a slide up here for it. It's the American Veterinary Dental College's website. So it's avdc.org.
Okay.
So you go to the homepage, and then I believe they revamped the page, so I may be wrong, but I believe it's on the upper right-hand corner. There's a thing for locate a veterinary dentist. And then they ask if you want someone who just does horses or someone who does all species. You click all species if you're talking for your dog. And then we're listed geographically by state.
Wonderful. Well, I cannot tell you how fabulous this was. I'm going to tell Dale what a great job you did as well. And I know that you agreed to do this as a volunteer, and we are so very appreciative to you. But you and your wife can plan a 2-night stay in Door County at my bed and breakfast if you'd like, compliments of moi. So
Well, I'm sure my wife will want us to take you up on that.
I'll bring it down when I bring Katie. Okay.
Okay.
Thank you very much, Steve.
Well, my pleasure, and thank you, everyone.
Bye-bye.
Bye.